All right, we're about to get started. Hopefully everyone can hear. And hopefully there's no echo now. This is Mayor Scott Fadness. I will now call the May 29, 2020 Fishers Board of Health to order. Just note for those on the phone or on the Zoom call that all board members are present here today with Dr. Indy Lane, our Chief Medical Direction person, is via Zoom call today. So glad to have everyone here. We're going to go through our agenda. First and foremost, I do not believe we have any announcements, but we will move on to department updates. And this is just a general discussion of the status of the implementation of our health department. Myself, I'm going to share a little bit of information. Chief Arusa can chime in on some of the aspects of what we're doing, as well as we have a new member of our health department here today, Monica Heltz, who we will consider later on in the discussion for formal approval of her being our Chief Administrative Officer. We were fortunate enough to have Monica come on board on Tuesday of this week, and so she's got a little bit of insight and information, having been here for a sum total of 72 hours. So she's going to share and chime in where she can. Under department updates, we kind of block these out into pillars of requirements for the public health department. And I'm going to go probably from some of the more administrative side back to what we're dealing with today with the pandemic and testing and things of those nature. So let's start with food services, or the environmental side of our public health department, our food inspections. What has transpired since our last meeting is the food inspectors have been identified. They're part of our fire inspection team. Those folks have all gone through the necessary training to become food inspectors. They tested this week, early this week I believe it was, and all of our inspectors passed, and they are now out what I would call field training. So they're working with our consultant. They're actually doing inspections in our restaurant community as we speak, learning from our consultant. And I think the last report I got this morning is they feel like as early as next week they'll be doing inspections themselves with her shadowing, and then hopefully as we progress that they'll be doing inspections on their own here in the very near future. Part of that move and part of the synergies, again, of being able to create this health department integrated into our organization, the folks that tested and trained, the vast majority of them were fire inspectors who were already going into these buildings at least once a year anyways to conduct life safety or fire safety inspections. So now we're able to do both those at the same time, which we think will be a great win. All of that has been done online and developed online with our Viewpoint Cloud system, which allows us to automate the entire permitting process as well as the inspection process. So we're excited about that aspect as well. Moving forward past food inspections, or the other pillar that we have under environmental would really be kind of this water quality conversation around pools. Obviously, as the weather gets warm, everybody starts to think about pools under Indiana law. Public health departments, both their public and semi-public pools, have to be inspected by a licensed certified pool operator. We have identified that individual. Again, it was someone within our ranks. Dave Dunbar is retiring from the Fishers Police Department. For those of you that know him, he's been a dive coach for a very, very long time within the Fishers High School. Has been around pools a good long time. He's gone through all the training, tested, and is now a certified pool operator. Next week, he will be shadowing with the state inspector around pools to do inspections, and we hope to be moving forward very quickly with all of that. That, again, has been put into our online system for permitting, and so it should be a very seamless process for someone to get their license or pool permit, and then we'll be following up with inspections moving forward. In both cases, both food and pools, that really deals with pre-existing facilities. The conversation prior to that is if I want to build a new restaurant or if I want to build a new pool, I have to go through the permitting process to get that once approved. We've hired two different consultants to assist us with that, and we'll talk through that here as we get into our agenda today. Chief Arusa or Monica, I don't know which one would prefer to jump in on the next pillar, which is really vital records. Maybe talk about the status of vital records.
Yeah, vital records is up and running. Death certificate, birth certificates are available. Some of the challenges, some of the birth certificates have been fixed, so we're going back and correcting those birth certificates that have to the hospital. That's pretty much our learning curve right now. So we're really grateful for the state and their cooperation with being up and running with Laboratories.
Are you accusing Dr. Lane of making mistakes already, Chief Arusa? Is that what's happening here?
I know the Jewish community.
Yeah. Okay. All right.
And our 341 community.
Well, careful, Chief. And then we plan on being able to print birth and death certificates as early as next week. Is that correct?
Yes, so we can purchase the printers.
So the workaround that we were doing with the state, hopefully we'll be off of that and on to others here in the near future. Another one we've been asked about, it doesn't happen all that often, but in Fishers are the regulation of septic tanks and wells. And so we have built those processes online and also have contractual opportunities for people to review. So if indeed we had to have a septic tank inspected, we have the technical capability to do that if and when those come along. So from an environmental standpoint, we're definitely up and running and moving quickly, and I think in the matter of the next few weeks, we'll really be able to be a fully functional out in the field department around proactive inspection. And we've also set up the ability for complaints to be registered. So from time to time, if a resident were to go out to a restaurant and see something that they feel is not conducive with food safety, they'll be able to file a complaint. We'll be able to investigate those. We've already had a handful of those already, I believe. So, and we're dealing with those appropriately as we move forward. The only other thing I would add to that is the legal framework behind these is Chris Gressel, our city attorney, is working with Monica as well as the staff around the environmental side to ensure that we have the right legal infrastructure to start enforcing local ordinances. And our intent is to bring those to the June council meeting for first reading, and in July we hope to have an approval, which will allow us to write these things against local ordinances and not just be enforcing state law going forward. So my anticipation would be at the next public health meeting, Monica would be able to brief you guys on kind of the status of those, and if we're changing anything from state law, what are those things that we want to do here locally that might just be slightly different than a state law perspective. Communicable diseases, I'll turn that over to Monica to maybe share kind of the status of where we are with contact tracing and communicable diseases.
Yeah, the contact tracing, as far as the coronavirus cases, we were all caught up from all of the contact tracing. We were getting them done that same day. Since the Fishers Health Department was formed, on May 18th, the Indiana State Department of Health took over all contact tracing in order to centralize it for the state. But we are still able to see and monitor the progress of all of that. And so we're monitoring that very carefully, and we're able to go back and even in some cases recommend extra measures that people can take to be tested or whatever's recommended. As far as other communicable diseases, we're receiving the reports from the state, and we've got a handoff from Hamilton County, and we're following up on all of those.
Great. And then maybe that dovetails nicely into the progress around testing. And Monica, Chief, or really Elliot, if any of you guys would like to give just a general update on the status of our testing capabilities and looking forward.
Yeah, I'd be happy to. So, to date, we have tested 2,447 residents of Fishers here at the site right behind us. We received 2,259 results to date. Of that, 24 have been positive, so that's just over 1%, 1.06% of our results have come back positive. We're able and capable to test 160, 170 individuals a day at the facility. Our assessments and therefore our scheduling has declined over the past 10 days. So we're only seeing maybe 60 to 70 individuals come through our doors in a given day this week.
Great. There's a couple other items of development that we're in the early stages of that aren't nearly as mature as these programs. And maybe Monica could talk a little bit about a question we've had around immunization. So what kind of immunization program we're going to put forward. So you want to talk a little bit about where we're at with that?
Yeah, sure. So we are working on an immunization program. That process we're getting, particularly really the state funded vaccine for children, which is the cornerstone of what public health departments provide as far as immunization. So that application process is fairly lengthy, but we are in that process. We are checking all those boxes and ordering the necessary materials in order to move as quickly as possible on being able to provide vaccines for our residents in need. There are a few other things that usually go along with that, and we're looking towards providing other services as needed for the community. I'm not 100% sure which exact services we'll be able to offer right away.
And it's important to understand Hamilton County is going to do immunization until our application and get everything.
Any questions on that for the time being? I think the goal here for the program and talking with Monica and Dr. Lane is, you know, I think all services are on the table for us to provide to our residents. We just want to figure out which ones are the most effective and can actually move the needle for our residents. So I think right now, no one should interpret the fact that we haven't done a particular program yet as us not wanting to do a program or interested in doing a program. We're just trying to figure out really what is it that our community needs, and then we'll go attack that aggressively once we have that opportunity to deep dive into that. And that's some of the work that Monica's beginning to do when Dr. Lane and her are having those conversations. Anything else from a department update standpoint that we didn't touch on? I don't believe that I'm aware of any. Couple things I would just share with you real briefly on the money side of things, financially, what this looks like. Right now, we feel fairly confident that the states, so just to brief you on, the state got $2.4 billion for costs associated with COVID. They then took $300 million of that money and said, we're going to allocate this out to all cities, towns, and counties across Indiana based on your population. So Fishers got a sum total of $3 million available to us for what they view as qualified reimbursable expenses. So they took the federal language that they gave to the state, and the state, for the most part, just passed that language down to the cities. What we know so far, we haven't submitted any expenses to date. We're packaging all that up right now. But if you read the language in black and white, it says, you know, COVID testing is a reimbursable expense. There's a variety of things in there that very much qualify for a lot of the things that we're doing. So the encouraging news to me is the city and the city council, the majority of the city council was prepared to spend $2 million in cash reserves on testing if need be, but it looks like, and all indications are, that we will be able to reimburse for all of those costs. So we're excited about that, and I think it also dovetails a little bit into a further conversation that I think Monica and Dr. Lane are going to have with you about where we go with our testing program moving forward. But from a financial perspective, we're very, very excited about that. We've also started modeling what we anticipate the revenues coming in for next year. And as we get into the 2021 budget, we're going to build out a comprehensive budget for the health department that stays within the confines of the financial realities that we'll find ourselves in for next year. But we feel very confident that we'll be able to deliver a high level of service to our residents with the resources that will be provided under the kind of financial structure that we find ourselves. If there are no other department updates, Chief, anything else you want to weigh in on? Monica, anything else? Dr. Lane, is there anything that you would like to share from just a general update perspective?
No, you did a great job.
Okay. We will move on then to a consent agenda. Now, if you recall from Chris's orientation today, consent agenda is just really a matter of administrative items that probably do not require any additional discussion. If any of you want to reserve the right, you can certainly ask that we take each one of these items individually. But at this point, I would call for a motion or entertain a motion for the consent agenda for the April 27th regular meeting minutes, as well as the May 8th executive session memoranda and the regular meeting minutes. Is there a motion? Motion by Chief Arusa. Is there a second? Second. All those in favor, please say aye. Aye. Motion passes unanimously. We will now move on to resolutions. Today we have 3 resolutions in front of you. The first one is a request to approve the First Amendment to a Laboratory Services Agreement with Mid-America Clinical Laboratories. If you recall, when it might have been our first or second meeting, the lab services that we were being provided for the testing site that's right behind us here, we went with Mid-America Clinical Laboratories. The cost associated with the lab costs were $85 per test. I was contacted by the CEO of the lab earlier this week, and he has asked if we would be willing to increase that cost to $100 per test. And my understanding is that the CMS has set the reimbursement rate at $100, and so at 85 he's losing money. And I understand and appreciate that. And I will tell you that, Elliot, you chime in here, and Chief, but I think Mid-America Clinical Labs has done a good job. They were early adopters into what we were doing and provided us a real opportunity. And so the resolution today is to approve an amendment to that contract to allow them to increase the cost of the testing to $15 per test, or excuse me, $100 per test. Are there any questions on that before we entertain a motion? Chief?
You probably couldn't have stood up that thing without national status. You didn't effectively as you did.
Yeah, it would have been impossible. They've been reliable and consistent as far as the supplies and returning results back, so they've been,
Are they gonna want any retroactive money, or is this just going forward?
No, they'll honor what they've done to date. So that's the other component, but if you think about it, the busiest time we've had will be under the $85 charge. We're now into a time where we're not testing nearly as frequently. So, in some ways, it was timed correctly for us in that regard. Any other questions, comments on that? Seeing none, I would entertain a motion to approve the resolution for the amendment. Is there a motion? Motion by the Chief. Is there a second? Second. All those in favor, please say aye. Aye. Motion carries unanimously. Next, we have a request to approve a professional services agreement with JTL Incorporated for certain plan review services. Elliot, do you want to touch on this one?
I can, absolutely, yeah. So, JTL, as a whole, is going to the land, consultant coming as to take on the responsibility of our restaurant plan review for new restaurants to come on board. We can contract out to individuals who know what's $50,000 annually. We use JTL for other services with our information section, point-based relationships. So confident that they have the skill set to be able to provide the service to us in a timely manner.
Any questions on that? Again, this is for the plan review. If someone were to come in and say they want to build a new restaurant, we have to have that initial plan reviewed to make sure we're complying with all state, federal laws, and they have the capability and wherewithal to do that, and we've used them before. Any questions on that? Seeing none, is there a motion?
Motion.
Motion, is there a second?
Second.
All those in favor, please say aye. Aye. Motion carries, thank you. Final formal agenda item today, resolution, is to request to approve First Amendment to an agreement with Qualtrics LLC for health assessment software. Let me tee this up, and then Elliot, you can talk about the specifics. Under the executive order by the governor, there is an element of it that says that every employer that comes back to work and brings their employees back to work has an obligation to create a plan for their employees and their customers. Within that plan, they require you to have some sort of screening process for your employees. In our conversations with employers, when we're on conference calls, when I'm out talking to small businesses, which I did for a couple days this week, the vast majority of them are really struggling with how am I supposed to assess my employees. It's not, if you're a small business owner, that's not what you do. It's just not something you're familiar with. We feel as though the city has a great opportunity here to step in and provide some service to our residents. And Qualtrics, which is doing the assessment and the scheduling for our testing, seems like a logical application to be able to provide to businesses from a customized perspective. And so Elliot Holgren, who kind of headed up the implementation and acquisition of our software platform for our testing, approached Qualtrics, and I'd like Elliot to explain kind of what the thought process here is and what the product would be and how they would use it.
Yeah, absolutely. So, on April 27th, this board approved Qualtrics as that software that Mary spoke about, to do that initial assessment, scheduling the test, to provide the results back to not only the city, but to the individual, and also the robust data analytics, that we're now receiving, to be able to dashboard and be transparent about what we're doing here in the city of Fisher. So, they've been a great partner. They implemented that software in about 6 days, which is pretty, unheard of as far as software implementations go. We think we're the city, this board and the health department have another opportunity for legal front to provide this opportunity to our entire business community, internally here in the city of Fisher, as well as our school district, for that health assessment software. So, this would be a $24,000 contract, including implementation hours, and we build it out. This board, Monica, Dr. Lane, create up to 20 questions that we would provide to companies and their employees. You know, take that either on a weekly, a daily basis, and the employer would see that exit, understanding of the health of their organization. Depending on the results of that assessment, it would let the individual know, hey, you should stay home, and we'll let the employer know where to stay home. They can follow on and take that test with more people where the individual employer substitutes. So, with this 24,000, we get the questionnaire, the survey, we get a dashboard to be able to apply to this board as far as that goes, as well as each company. And it's probably safe to say it's 1 to 2 weeks still to implement that. So, in good faith, they can start today, pending approval from the board.
Any questions on that? I know this is a new concept, Chief.
Yeah. Chris, could you just talk about the privacy applications, something like this? If there is anything wrong.
So, with respect to the data that's coming in from the people that are taking the assessment, Qualtrics is giving them direct feedback, right, one-on-one with them. The data that we collect is more in the aggregate form of understanding the assessment value. So we're not getting information back, right, Elliot, of detailed individual assessments.
I think this is a good opportunity to, maybe Monica to talk about this. I've heard some chatter out there in the general population about contact tracing and this information and data that we are gathering. People are wondering, first of all, if you don't know what contact tracing is, you start to think that we're, tracking you and your cell phones and from satellite dishes and, all kinds of things. And I think I just want maybe to talk about what is contact tracing from our perspective, and then also as we think about this data gathering and epidemiology, what that really looks like and what that means to a person's personal privacy.
Yeah, so contact tracing is a public health strategy that's used to control infectious disease. This is very commonly used in tuberculosis control, and it's also very commonly used in STD control. And it centers mostly around interviewing the person who has the infection or any people that they may have possibly exposed or been exposed to. And then the contact tracer would go and talk to the potentially exposed individuals and recommend their next steps, whether it be to quarantine or to get tested themselves, or whatever the recommendations are for particular strategies. Nobody is, we don't have the technology to trace your cell phone action, so that's certainly not something that's happening here in the United States. So this is all dependent on information that's provided to the contact tracer by the infected individual. Sometimes the contacts are notified anonymously it can be done through text messaging software for different conditions. Sometimes it's a Board of Health member or a health department employee who notifies the potential contacts, and sometimes the infected individual also or instead notifies the people they may have exposed. But it is an important method of infectious disease control. So.
I think what's important too, we had a law partner from Barnes and Thornburg on the call the other day with businesses. Now that it's said that you have to have the screening process, there's a liability question that lingers out there that if people were to get sick or, and you don't have those things in place, what does that mean from a liability standpoint? So there's a whole legal world that is yet to be settled on what the long-term liabilities of these things are. And so what we're really trying to attempt to do here is really accomplish two things. One, to increase the number of people following the best practice of doing assessments, then we can aggregate that data and understand it, but then also giving our business community tools that limit their, mitigate their risk and liabilities long-term as a business owner. So anything else, Elliot, on the, okay. With that, I guess I would entertain if there's a motion to approve this amendment to our agreement with Qualtrics. Motion, is there a second? Second. All those in favor, please say aye. Aye. Motion carries. Those are it for our resolutions. We'll now move on to regular items. First and foremost, when we instituted our health department back on April 24th, we were good enough to leverage some of the skill sets and talent that we have within our organization to stand it up and get it moving, given the fact that we had a pandemic and we wanted to get moving on testing. Chief Arusa had people within his team, like Chief Davison, that were willing to lend a portion of their time to helping this get started. But obviously, as we developed it and we really wanted to find the right people to lead it and get the qualified individuals in that we needed, we were excited to bring on Dr. Lane as our medical direction. But then also we really wanted to find someone that could be the chief architect behind the operations of this organization as we move forward. Fortunately for us, a Fishers resident stepped forward who has an unbelievable background and passion for public health and has come on board as soon as this week to hit the ground running, and that's Monica Heltz, who's here today as what I would propose as our Chief Administrative Officer. Monica's resume speaks for itself with education from University of North Carolina, Johns Hopkins, as well as pretty much all four corners of the world. She's been serving people in the public health role as well as a nurse practitioner. And so we're really, really excited to have Monica come on board. And with that, I guess I would like to make the motion to approve Monica as our Chief Administrative Officer. Is there a second? Second. All those in favor, please say aye. Aye. Congratulations. Go to work.
Here's one side note. Before she left Marion County, she would come on her days off and work in the health department.
Yeah, there you go.
That was awesome.
Yes, she's got a lot to do. And speaking of that, the next agenda, I'm glad to turn it over to Dr. Lane and Monica, who have already started to brainstorm about how we can provide potentially even more value to our residents, and this is an item that they wanted to bring before the board today. So, Monica?
Yeah, so, up to now, our testing policy has just been for folks 18 and up. And just given that we have increased capacity to serve more individuals, I would propose that we consider testing younger individuals, perhaps as young as 12, based on the comfort level that you all feel. We are not doing the nasopharyngeal testing here. We are doing the similar. So it would not be at quite the invasive level that the nasopharyngeal entails. But I do believe that we have the testing capacity, and this would solve some issues for concerned residents, perhaps wanting to have their teenagers be babysitters for another family, if we looking at healthcare issues, or getting two teenagers to be able to go into work and employers are requiring testing that person.
One of the obvious questions that comes up is how we deal with consent and those protocols, and I know operationally and tactically you're still working through that, but can you talk a little bit about, what our thoughts are and how we approach that?
My initial thought on how to approach the consent is that the parent would probably need to accompany the minor in order to assure that it was the parent and that it was consented.
Dr. Lane, is there anything that you wanted to chime in on this particular item?
No, I missed the last part of what Monica said about, I'm assuming you said that the parent would provide some consent prior to the test.
Ideally, the parent would accompany the juvenile to the test.
Right. I think that that's a reasonable approach, and the ones that are less than 16 can't drive themselves anyway. So I would assume that they would come with a parent or guardian. So that should work out.
Any, for general discussion, anything from the board, questions, comments, concerns about, lowering the age to 12?
Why not eight? Generally, 12 or 14 are, kind of standard setup. I believe the state testing, goes to 12. So that's been fairly standard at a lot of the other sites, so just add some consistency on that level. Why not eight? I started 12.
Is there any concern, I mean, we got a whole room full of people that are qualified in this. Is there anything from our paramedics' perspective at administering this that causes you concern as you get below that age and get into a younger age? Yeah, right, yeah. That's fair. That's fair.
Really, that's why I was wondering about the age.
Dr. Lane, something on that? You might be muted or.
You're muted.
So I didn't hear the last, I could hear the mayor, I couldn't hear.
Yeah, the point by your colleagues here in the room was, you know, the only I asked the question in terms of, are there concerns from a paramedic administering that to someone younger than 12? And the folks in the room said really the only thing is the kid's cooperation, the likelihood that the kid's going to sit still as they get younger, and what does that mean for chiefs, firefighters, and paramedics to be able to administer that. That was really the comment so far.
Right, and prior to starting the testing, I did consult with a pediatrician, and that was their concern with younger than, at the time, the cutoff was 18, but with children just being still, I think the fact that it's just the nares makes it an easier test. I would defer to the personnel that are doing the test, but I think most 12-year-olds will cooperate. And I don't know if we need to have some verbiage to say that if the child doesn't cooperate, we reserve the right not to do the test. But I think 12 is a reasonable cutoff.
I guess the question then is, why not lower if you have the verbiage, if a 10-year-old cooperates, but a 13-year-old does not cooperate?
So, Dr. Lane, in case you weren't able to hear that interaction, the question was, why not just, if we're going to have that verbiage that says if kid's not cooperative, if we have that verbiage, would we consider just lowering the age even lower?
I think initially I would kind of like to align with what other testing sites are doing. I think that with some of the data that's coming out about kids and the various manifestations, I get a little concerned about not having the proper follow-up for those kiddos, just because I'm not super familiar with the pediatric population. I could be swayed, but that's my initial concern, just kind of aligning with what other testing sites have stated as their cutoff. And I think that's kind of what Monica and I, correct me if I'm wrong, Monica had kind of discussed the reason why we had selected 12.
Monica, you might know the answer to this better than anyone. Does contact tracing change the manner in which you do it when it's a juvenile? Okay. So you're just making contact with parents or however you.
Yeah.
Go ahead.
Can I ask a question about just administering the test to younger children, the size and getting into the car? They may cooperate, but I don't know that.
Yeah, I think that, our guys have been doing the administration to adults inside the vehicle. There is no issue about having kids inside the vehicle, and stuff. I think that's reasonable. I agree with, the worry that cooperation is going to be key, and having a parent present is going to help that. But we'll have to take it on a case-by-case basis. I am in favor of the language that says that we have the right to refuse if the child is going to cooperate.
And just to back up Dr. Lane's point about not doing younger than 12, I think she brings up an important point of having assessment if there's any concern about the kid, and then also a concern about a parent possibly interpreting a negative result to mean a true negative without a physician evaluation. probably be better to have a physician evaluate that child, given the different implications of the disease possibility in children. So I guess that's further back up the 12 idea. I think it would be unlikely we're going to have real trouble with uncooperative 12 and up year olds, especially with being in there.
I think the only thing I would caution all of us about is whatever we decide to do now, just understand we're quickly rounding the corner to the opening of the school. More than likely school will open in August, I think. I don't know. I'm not privy to those conversations, but assume that if we start opening it up to juveniles, if school, there could be some further discussion then are we testing every kid before they go back to school? All those things start to come up if we start to provide those services, and we just need to be prepared for that discussion if we're going to provide this. So
I would think too, hopefully by July or August, if we lower the age, we will have at least have some tests and some experience that we could use. And then I think it'll give us an opportunity to kind of consult with some pediatric colleagues to see what their recommendations are so that potentially we can offer the service for the reopening of schools. But it's just getting some more data, getting some more experience, I think, and kind of starting at 12 would be my preference. Initially, with the thought that, hopefully we could lower the age and expand it to whatever services the schools might need.
And so I'm clear too, is the expectation then that the 12-year-old or the 13-year-old would go online, fill out that assessment to be able to schedule for a test? Because there's an operational component here. Like everyone else, you go on, you fill out your email and your contact information, you take the assessment, and then you can go get a test. Would they follow the same process? And if they were doing that assessment, are we going to need some sort of parental consent at the beginning of the assessment before they can schedule a test?
Yeah, I think the parent needs to fill that out, but we may need.
Absolutely.
Okay. So I guess
A log on to find the result, right? Don't they have a log on to get their result as well?
Yeah, so that would be another component to make sure.
Email, phone number, component to it, you got 14-digit identifier.
So we would have to figure out how that goes to a parent and not to the kid, obviously. So there's definitely some operational things that we're going to have to figure out how to accomplish to ensure that this can be done. But I guess for the purposes of policy, assuming that we can meet all legal requirements and figure out how to do it operationally, is there, I guess this probably does require a formal vote on this particular item. Is there a motion to reduce the minimum age to 12? So moved. Is there a second? Second. All those in favor, please say aye. Aye. Motion carries. And we'll keep the board informed as we move forward in the timing of that when we know we can actually accomplish it. And obviously, we'll communicate that to the public when the time is appropriate. We'll push that out going forward. With that, I would want to open it up to any just general board questions, comments, or concerns at this time for open discussion. Are there any?
I had a quick comment.
Sure.
Regarding the data collection, I'm looking through that down the dashboard, and it's a great start, in my opinion, but I mean, is there a plan in place to help expand that? Like market ourselves a little bit more to get more data collection, to get more evidence tested? Because honestly, after a month of testing, I figured the numbers would be a little bit higher than they are currently.
Yeah, so in terms of driving traffic from the site, not only take the assessment, provide the test, we're increasing messaging around, that it's okay to get a test even if you're asymptomatic, so there's some concern in the community, just based off of what I've seen, that they don't want to take a test away from somebody who might need it. And I think with the data that we've seen, we have the capacity to be able to accommodate those that are asymptomatic. So we've started inserting that messaging into our Additionally, we've launched the Fisheries Health Department social media, and so that's one more channel that we need to get out into the public. And so, we're continuing across all of our public safety channels, our fisheries government channels, so that's Facebook, Twitter, Instagram, and Nextdoor, to continue to push out that testing is still available, because there was also some confusion that maybe it was just for one day or for 1 week, similar to the state, site. So we're just trying to continue to push that out. We've also, have invested a little bit of money in social media advertising, just to help spread the message to those who may not follow our channels. My hope also this week was with the release of the dashboard with demonstration to also get this testing. So we have our eye on that, and try to keep those numbers up. And I think with people starting to emerge as well, I think around Q4, we may also see an increase in at least people going to the site, to the website, to learn about it. So we'll keep those on our radar.
Go ahead, Monica.
And jump into, the site is on the list of sites on the state website too, because that's where the state Department of Health is directing people to look for COVID testing sites. And we are listed on there. So hopefully anybody, at least in the area, is gonna find us pretty quickly that way.
We've got an unbelievable number of people who have tried or called to get tests that don't live in Fishers to utilize the site. We've had a lot of that. One of the other areas I think we'll continue to try to challenge ourselves creatively, helping those populations that we know are more vulnerable to truly the ill effects of this disease. So long-term care facilities, we have large senior populations. Our largest neighborhood in Fishers is 55 and older. I mean, direct communications with all of those people. I think we need to figure out how we can creatively come alongside those folks and really try to help from using our testing and assessment infrastructure moving forward. We need to figure out how we continually connect with those folks.
And just to build on that, we do have weekly HOA leadership communications that are going out right now, and testing is part of those communications. Those go out every Friday, and testing is in this week as well, so we'll continue with that.
What about like mailings? I mean, I know 2020, what about those residents that are older than that, like that, you know,
Yeah, so we've, throughout the COVID pandemic, we've done targeted mailings to those communities who are the age-targeted communities, so 55 and older. We've done those approximately every 2 to 3 weeks, direct letters to those addresses. Now, we know that that only reaches a certain percentage of those folks. At the beginning of our testing availability, we sent a postcard to every single household in Fishers. And then we have our monthly magazine that will come out, quarterly magazine that will come out in the July edition. That will hit inboxes towards the end of June. So,
I think one thing that's maybe nuanced that we could talk about as a board and as an organization is we've portrayed to the community, and rightfully so, that we were setting up this testing site as a service for them, so that if you felt sick, if you were worried, you could come in and get it. What we haven't done or communicated to the public is like, hey, help our community and our health department understand where we stand with COVID. If you have 5 minutes, come in and get a test. We haven't gone that route because we were really trying to meet the need of the people that were concerned or scared. It would be a significant departure in messaging intent if we wanted to start saying, hey, we're trying to, from an epidemiology standpoint, we're trying to get a better sample size. Therefore, whoever you are, if you got 10 minutes, swing by here and get a test. And I think the board, Dr. Lane, Monica, we would all have to really, if we ever got to that point, that would kind of be a fork in the road in a different direction. Not to say it's the wrong direction, we would just have to discuss that. I don't know, Dr. Lane or Monica, if you guys have thoughts on that at this point.
I don't think we're trying to take on doing a full-on study at this
Yeah.
moment when we're trying to build the health department. But I would certainly encourage anybody that's concerned to get tested. That's kind of thing.
Yeah, no, it's a loaded question for sure. Because I think, Ashley, our messaging to date has been, to your point, if you're concerned, come get a test. We haven't phrased it as, it's your patriotic duty, you know, kind of thing, to like, come get your test. Yeah.
I'd like to, we get patients in the emergency department, and then because of the state requirements for testing and this and that, if they're healthy looking and all that. So my question is, have we reached out to the local hospitals and emergency departments to say, you know, if you get a patient,
That's
you can always tell them, hey, we can't test you here, but Fishers has it for their own.
That's a great point. That's a great idea. That's a great idea.
Yeah, I mean, I think you would get, and then the other thing is, I'm not sure if we ever thought about a mobile unit, that for the elderly.
Yeah.
That might not be able to come.
I think we have the capability certainly to do that. We've done it once already, and we could do it again in those targeted areas. And I love the idea of the strategic relationships with the medical facilities, because I know their hands are tied from a protocol perspective, so.
So I guess the other point I wanted to make, as far as the messaging and who we want to encourage to get tested, the messaging so far for contact has been just to quarantine in your house and monitor yourself for symptoms. I would like to see us change that messaging to go ahead and get tested if you have continue to quarantine yourself for symptoms. But that then takes our contact investigations out or not, and will allow us to have a better control over the disease. So we're trying to do that with by backing up the state's contact investigations that they're doing, by taking that extra step and recommending that to the contact. But if we wanted to make that messaging in addition to our current messaging, that would be the first place I would want to go.
Yeah, it makes all the sense in the world, and we're trying to do this with employers as well. Like, hey, if you had somebody get sick or they're concerned, get tested, and economically for them to have the ability to find out if someone has the disease or not is certainly helpful. So these are all great feedback that we'll continue to work on. Anything else for the sake of the discussion? I don't want to take up everyone's Friday afternoon. Seeing none, is there a motion to adjourn? For a second? All in favor, please say aye. Aye. Meeting adjourned. Thank you, everyone.
Thank you.
Dr. Lane.
Thank you.